Hello. Now let's check on the surgery MCQs that you guys did previously. Courtesy of medical students or Arena, this is Auma presenting. The first question was, is in a vascular surgery, what is the purpose of carotid endarterectomy? Okay. In a vascular surgery, what is the purpose of carotid endarterectomy? Now, removal of atherosclerotic plaques from the carotid artery, repair of aortic aneurysms, creation of vascular shunt, insertion of stent or of a stent in the coronary artery. Now, uh, the correct answer is removal of atherosclerotic plaques from the carotid artery. Okay. Now, carotid endarterectomy, or what we call the CA, is a surgical procedure specifically designed to remove atherosclerotic plaques build up from the carotid arteries. Major arteries in the neck that supply blood to the brain, we call them the carotid arteries. Okay. This surgery is primarily done to reduce the risk of stroke in individuals with significant carotid artery stenosis, usually equal more than even 70% caused by atherosclerosis. And atherosclerosis is just the deposition of plaques in the lumen of arteries, resulting to what we call narrowing of the arteries. So removal of the option A, which is removal of the atherosclerotic from the carotid artery, is the correct answer because the goal of the CA, okay, or what we call the coronary endarterectomy, is to restore normal blood flow to the brain by surgically removing obstructive plaque from the inner lining of the carotid artery. And then option B, repair of aortic aneurysm. This refers to the aneurysmectomy, like we call it aneurysmectomy. Aneurysmectomy or endovascular aneurysm repair, EVAR, which is unrelated to carotid artery disease. Creation of vascular shunt. Vascular shunts are often created in dialysis patients and arteriovenous fistulas or in cases of trauma. This is not the purpose of carotid endarterectomy. Okay. Insertion of stent in the coronary artery. This is described percutaneous coronary intervention, the PCI, also known as the angioplasty, used in coronary artery diseases. Okay. So just a percutaneous coronary intervention. Insertion of stent in the coronary artery. So carotid endarterectomy is most effective in symptomatic patients with transient ischemic attack or minor strokes, and has been shown they are actually significantly reducing the risk of future ischemic stroke. Okay. The second question is, what is the primary goal of a mastectomy in breast cancer surgery? Okay. The primary goal of mastectomy in the breast cancer surgery. Now, A, removal of the entire breast, preservation of breast tissue, excision of axillary lymph nodes, and D, reconstruction of breast shape. Correct answer is removal of entire breast. What about something ending with ectomy? I told you just that is removal of an organ or removal of part of the body. So mastectomy is surgical procedures performed to treat or prevent breast cancer by removing all or most of the breast tissues. It is commonly indicated in patients with large tumors, multifocal diseases, high risk of recurrence, or genetic predisposition. So removal of the entire breast, that is A, which is the correct one, because that is the primary objective of mastectomy is to remove all the breast tissue. So it includes the tumor which may be there to be so with the way if we remove the tumors, we are eliminating cancerous cells or reducing the risk of cancer development in high risk individuals. B. Preservation of breast tissue. No, this applies to breast conserving surgery such as the lumpectomy, not mastectomy. So we have the lumpectomy and mastectomy. Mastectomy does not it does the opposite. It does not actually preserve the breast, but it removes the tissue. Excision of axillary lymph nodes. No. Yeah, because while axillary nodes dissection essentially lymph node biopsy is often performed alongside mastectomy for staging and management, it is not the primary goal of the procedures. Reconstruction of breast shape. Breast reconstruction may follow mastectomy, either immediately or later, but it is separate goal performed by a plastic surgeon. It is not the main purpose of the mastectomy itself. Okay, so the types of mastectomy include the simple mastectomy, modified radical mastectomy, and radical mastectomy. So if you are told to list the types of mastectomy, we call the total mastectomy we would call the simple mastectomy, and then you have the modified radical mastectomy and the radical mastectomy with the varying degrees of tissue and lymph node removal depending on the cancer stage and spread. So it's also that very keen to be known. Now, which surgical technique involved the third question that involved the removal of portion of liver due to tumors, portion of liver due to tumors or other liver diseases? We have cholecystectomy, hepatectomy, splenectomy, nephrectomy. Okay. So with surgical technique, well, they remove the okay. So here is hepatectomy. You know, see the cholecystectomy talk about the gallbladder. Hepatectomy, the hepatocytes, is the cells of the liver. So that is the color. Splenectomy, that is just the spleen. Nephrectomy is part of the nephron from the kidneys of being removed. So ectomy means the suffix ectomy is removal. So what lies the liver? The correct answer is B. Okay. So hepatotomy is a surgical procedure that involves the removal of part or maybe the entire liver, typically performed to treat primary or metastatic liver tumors like trauma or other liver diseases. Now, the extent of the resection depends on the location and size of the lesion, as well as the function reserve of the liver. So, hepatostomy is the correct answer. Okay, partial hepatectomy, we have it, the most common approach for removing localized hepatic tumors or diseased segments of the liver. So, a total hepatectomy is rare and usually precedes a liver transplant. Okay, so when you remove the whole liver, you have to replace another one. Colostomy, now removal of gallbladder. They were told you. Splenectomy, spleen, blah blah blah. The fourth question. The fourth question. In urologic surgery, what is the primary indication for transurethral resection of the prostate? I remember this question, we struggled it initially. So TURP, transurethral resection of prostate. Treatment of kidney stone, removal of bladder tumors, correction of urinary incontinence, treatment of benign prostatic. So yeah, so in urology surgery, what is the primary indication for transurethral resection of the prostate? Treatment of kidney stone, removal of bladder tumor, correction of urinary incontinence. So let's see. The correct answer here is treatment of benign BPH. Okay. Transurethral resection of the prostate, the gold standard surgical treatment for benign prostatic hyperplasia. An unconsidered enlargement of the prostate gland that commonly affects older men leads to lower urinary tract symptoms, called the LUTs. So the treatment of benign prostatic is correct answer for the TURP. Okay, because it involves inserting a resectoscope through the urethra to trim excess prostate tissue, relieving the obstruction and improving urinary flow. So it is especially indicated in moderate to severe BPH with complications like urinary retention, recurrent UTIs, or bladder stones. Treatment of kidney stones. Kidney stones are usually managed with lithotripsy, ureteroscopy, or percutaneous nephrolithotomy. TURP is not used for this condition. Removal of bladder tumors. Bladder tumors removed using a different procedures called transurethral resection of bladder tumors, and not transurethral resection of prostate. Okay. So correction of urinary incontinence. TRP is not used to correct incontinence. In fact, urinary incontinence is a possible complication of TRP. So if the sphincter is affected, you remember we'll have incontinence. So treatment for incontinence include the pelvic floor exercise, sling procedures, or artificial urinary sphincter. Continence, get pelvic floor exercises, sling procedures, or artificial urinary sphincters. Okay, so to TRP patients are typically monitored for hematuria, urinary retention, and TRP syndrome, a rare complicated due to fluid absorption. A three-way Foley catheter is often used for continuous bladder irrigation. So, which type of hernia occurs when a portion? That's another question. Which type of question number 5? Which type of hernia occurs when portion of the stomach protrudes through the esophageal hiatus into the thorax cavity? Now, this is the thing. We have hernia. These are surgical conditions. Okay. Remember, we're handling MCQs to do with surgery. So, hernia, they're mostly protrusion of body parts from internal cavity of the body, and they display their presence by just protrude through the skin, so you can be able to see. So based on the location where they can happen, like hiatal hernia, umbilical hernia from the umbilical region, inguinal hernia on the inguinal region, femoral on the femoral region. So we have names. Okay. So the question is, which type of hernia occur when the portion of stomach protrude? This one is very easy, and you know that. Call it a hiatal hernia. Hiatal hernia occurs when part of the stomach pushes upward through the esophageal hiatus, an opening in the diaphragm into the thoracic cavity. It is commonly associated with the gastroesophageal reflux diseases and can cause heartburn, regurgitation, chest discomfort, and even difficulty swallowing. So, this is the correct answer, hiatal hernia, and it involves initiation of stomach tissue through the diaphragm. There are two main types: sliding hiatal hernia, most common, gastroesophageal junction, and part of the stomach slide into the chest. That is sliding hiatal hernia. Okay, very common one. Okay, yeah. Then you have the paraesophageal hernia. The paraesophageal hernia, the stomach herniates beside the esophagus, but gastroesophageal junction stays in place. Then umbilical hernia, this occurs near the navel, the umbilicus, kitovu, when the abdominal contents protrude through the abdominal wall. It is common in infants and often resolves spontaneously. Then you have inguinal hernia. This happens when tissue protrudes through a weak spot in the groin, the inguinal canal. So the most common types of hernia, especially in males, and the ones who go for exercise mostly. These were femoral hernia, the cause just below the inguinal ligament. When abdominal content pushed through the femoral canal, it's more common in women and that carry high risk of strangulation. So, for example, when you're engaging yourself in occupation demands a lot of stress and force, full activity, that is, you can get that. So, hiatal hernia may be diagnosed, but so I'll say that we have a paraesophageal hiatal hernia. I've talked about sliding hiatal hernia, and you should really remember that. Okay, so that is nice. Okay, so hiatal hernia may be diagnosed by barium swallowing or endoscopy, and treatment include lifestyle changing like PPIs, surgical repair like Nissen fundoplication. That is if it's severely of symptomatic. Which surgical procedure involves the removal of entire colon and rectum and creation of an ileal pouch and anastomosis to form a reserve for fecal storage? Okay. So which surgical procedures involve the removal of the entire colon and rectum and creation of an ileal pouch and anastomosis? Okay. IPAA to form a reservoir for fecal storage. So we have total colectomy, appendectomy, hemicolectomy, sigmoidoscopy. The last one is funny, it's not cannot be that. So it's called total colectomy. The described procedure removal of the colon and the creation of an ileal portion is what we call the total proctocolectomy. That is IPAA, but is often referred to generally as a total colectomy. Okay. Now, when the full colon is removed, that's part of the process. Okay. So totalectomy, yeah, that's all. Colectomy, total colectomy involves removal of the entire colon, the way I'm telling you, the rectum was removed. So it becomes a protocolectomy, and the IPA allows the end of the small intestine ileum to be shaped into a pouch, usually a J pouch, which is then connected to the anus, enabling continence without a permanent ostomy. So this procedure is most often used in patients with ulcerative colitis, familial adenomatous polyposis, appendectomy, this surgical removal of the appendix and that's nothing to do with the colon or rectum. Hemicolectomy, this involves removal of only one side, right or left of the colon, does not remove the entire colon or rectum and does not involve IPA. So this is a diagnostic procedure, not a surgical treatment. It involves visual inspection of the sigmoid colon and rectum using a flexible scope. Okay, so an IPAA allows patient to pass stool through the anus after removal of the colon and rectum. So temporary lobulostomy is often critical during healing and reversed later. It can be reversed. Okay. So what is the primary purpose of the ROX and Y gastric bypass in bariatric surgery? What is the primary purpose of the ROX and Y gastric bypass in bariatric surgery? Restriction of food intake, absorption of nutrient, removal of gallbladder, prevention of gastric acid excretion. The correct answer is restriction of food intake. The Roxanne gastric bypass, the RYGB, is one of the most common and effective types of bariatric weight loss surgery. It achieves weight loss primarily through Roxanne gastric. It achieves through restricting food intake through though some degree of bowel absorption is also involved. Okay, so restriction of food intake, this is the correct answer. RYGB, a small gastric pouch is created from the upper part of the stomach, drastically limiting how much food the patient can eat at one time. So this significantly reduces caloric intake, leading to weight loss. Okay. So malabsorption of nutrients, while RYGB does include bypass of part of the small intestine, resulting in some malabsorption. And this is not primary mechanism of action; it's a secondary effect compared to the restriction of intake. Okay. So that is that. That is that. Now, option C, removal of the gallbladder is not part of the RYGB. Reason why yeah, gastric something, then why gastric something. It's not that purpose to remove a gallbladder. No, although gallstones are common complication of rapid weight loss, I may require what we call the cholecystectomy. This is not intended or primary goal for the surgery. Prevention of gastric acid schedule, while acid production is produced by due to bypassing much of the stomach is not done to suppress gastric acid. So RYGB is not done for that. That's more relevant in treating ulcer diseases. Okay. So, patients who undergo YGB must commit to lifelong nutrition supplementation, iron and B12 of calcium folate due to reduced mass absorption and altered digestion. Regular follow-ups and session prevent deficiencies. Okay. Now, what is the primary purpose of splenectomy in surgical practice? Restriction of food intake, malabsorption, nutrients, removal of the gallbladder, prevent gastric acid secretion. Primary purpose, no, no, no. The primary purpose of splenectomy in surgical. Okay, treatment of pan. I was reading one thing. So, what is the primary purpose of splenectomy in surgical practice? Treatment of pancreatitis, removal of a ruptured appendix, correction of an enlarged spleen, management of immune thrombocytopenic purpura, the ITP. Okay, immune thrombocytopenic purpura. With proper splenectomy in surgical practice. So, pancreatitis, remove ruptured appendix, correction of enlarged spleen. So, what is the answer here? The correct answer is management of immune thrombocytopenic purpura. Okay, so not only the surgical removal or the spleen performed for various reasons, including trauma, hematologic disorder, or malignancy. One of its most well-known therapeutic indication is in the management of ITP, immune thrombocytopenic purpura, a condition where the immune system destroys platelets, leading to bleeding risk. Management of immune thrombocytopenia is the correct one. Okay. Treatment of pancreatitis is not used in treatment of pancreatitis, bro. Removal of ruptured appendix, that one is not yet correct. Correction of enlarged spleen, splenomegaly, enlarged spleen is a symptom, not a disease. So splenectomy may be indicated if the cause of enlarged lead to complication by hypersplenism, but ITP is a more specific communication in surgical practice. So what I need to know is that after splenectomy, patient are increased risk of overwhelming post-splenectomy infection due to impaired immune responses, and vaccinations against pneumococcus, meningococcus, and Haemophilus influenza B are essentially pre or post-operatively given. Okay, so in orthopedic surgery, what is the primary indication for performing arthroplasty? Arthroplasty is just cosmetic correction of a joint or yeah. So orthopedic surgery, what is the primary indication of for performing an arthroplasty? Repair the torn limb, remove bone. Remember, we want the primary indication. So all these answers might be correct, but we really need the first correct answer. So mostly joint replacement due to degenerative disease. That's the correct answer. Okay, as well as a surgical procedure that involve reconstruction and replacement of the joint. The primary indication of arthroplasty is degenerative joint disease, most commonly osteoarthritis and also rheumatoid arthritis or post-traumatic arthritis when pain and loss of function significantly impact quality of life. So joint pain due to degenerative disease, this is the correct answer. Total joint arthroplasty, total hip or knee replacement is performed when conservative measures like medication, physical therapy fail to control symptoms of chronic painful arthritis. The goal is to relieve pain, restore mobility, and improve joint function. A repair of torn ligament, this is typically managed by ligament reconstruction or arthroscopy. Removal of bone spurs, osteophytes may be addressed during orthoscopic debridement, but not the main reason for arthroplasty. Correction of bone fractures. Fractures are treated by open reduction and internal fixation of casting, not arthroplasty. However, in elderly patients with complex joint fractures, femoral neck fractures, like for example, a joint replacement may be indicated, but the general reason remains degenerative or non-constructible joint damage. So arthroplasty is more common in the knee and hip, though it may also be performed in the shoulder and elbow finger. Prosthetic joint can last between 20 years, and patients are advised on activity modification to preserve joint integrity. Okay. So the final question for sure. What is the primary purpose of colostomy following colorectal surgery? Diverting fecal flow for temporary healing, preventing infection in surgical wound, removing cancerous, improving digestion and nutrients. So, close surgical procedure to current diverting fecal flow temporary healing. Yeah, so it's a surgical procedure in which an opening ostomy is created by bringing part of the colon through the abdominal wall to allow stool to exit the body into colostomy bag. The primary purpose of this intervention, especially after colorectal surgery, is to divert fecal matter away from the healing site, such as an anastomosis or surgical wound, in order to allow proper healing without contamination or strain. So that is that. Okay. So the correct answer here is diverting fecal flow for temporary healing. Prevent infection in surgical wound. Now, while diverting stool indirectly reduces infection risk, this is a secondary benefit. The main goal is diversion, not wound antisepsis alone. Okay. Removing cancerous tissue cancer removed done via colectomy, proctectomy, or other resection, not colostomy itself. So the colostomy may be performed after cancer is removed. Improving digestion and nutrient absorption. A colostomy does not aid digestion or nutrient absorption. In fact, it may slightly reduce water absorption if stoma is in the proximal colon. So it plays no direct role in nutrient. So that is that. And colostomy can be temporary or permanent depending on the nature of the disease and the extent of bowel resection. Patient education, emotional support, and ostomy care training are crucial components. Thank you so much as you're waiting for the next. Yes. You can like and